Hello, I'm Dr. Sushma Harish. While pregnancy is a time for incredible changes physically, emotionally, and as well as sexually, many couples have doubt about is it safe to have intimacy during pregnancy or after birth. Let's talk openly and honestly about intimacy during pregnancy and after delivery, whether it is safe, when to be cautious, and how to have intimacy without affecting you and your baby. Sex can help in inducing labor, especially in the later trimester. Why? Because semen will release prostaglandin, which helps in ripening of cervix and also induce onset of labor contraction. But it is not applicable to all, and it is not safe for everybody, and it is not a guaranteed method of induction of labor, and it never substitute medical method of induction of labor. And avoid sex when there is water leak to avoid ascending of infection. While there are a lot of hormonal changes during pregnancy, your libido keep changing in each trimester. In first trimester, there is plateau of the estrogen level, and also you will be feeling nausea, vomiting, fatigue. There is decreased libido. Again in second trimester, because of increased blood flow to the uterus and the cervix, you may have pleasure and you have increased libido. Again coming to third trimester, because of heaviness in the abdomen, difficulty in breathing, and also easy fatigability, again there is reduction in libido. Absolutely yes, because of certain hormonal changes and increased blood flow to the uterus and cervix, it is definitely that you may sometimes have increased libido, sometimes you don't feel like having intimacy. It is all normal. And because of increased vaginal secretion, you may experience excessive vaginal discharge after intercourse. So each person is different. Talk to your partner and act accordingly. While orgasm causes mild lower abdominal pain, it is usually harmless because your baby is protected with amniotic fluid. Your uterus and cervix, it is completely covered like a cushion, so your baby is completely protected and safe. There is no harm having intimacy during pregnancy, but except for certain medical conditions. So always discuss with your doctor and take personalized opinion and care. In certain high risk conditions, like those who had bleeding in the first trimester of pregnancy, those who have short cervix, that is the mouth of the uterus is small, or when there is increased risk of preterm delivery like twins, or when there is excessive water around the baby, and when the placenta is low lying, when the placenta is attached to the lower part of the uterus, what we call as placenta previa, all these conditions are high risk. So your doctor will advise not to have intercourse in special conditions. So it is important to discuss with your doctor. Yes, it's common to have pain or discomfort during intimacy as the pregnancy advances, especially because of pressure or backache and maybe problem with the position. So you can try changing the position or using lubricants or using non-penetrative type of intimacy. But if you have sharp stabbing like pain, please talk to your doctor about it. Usually we advise to resume intercourse after 6 weeks of delivery, but each individual is different, especially when post-cesarean or if there is perineal tear. Please take your doctor's advice. And there is decreased libido during postpartum period because of hormonal changes, fatigue, sleeplessness and breastfeeding. Always go slow, talk to your partner, use lubricants and discuss with your doctor when in need of help.